Hello, I'm Dr. Jeffrey Niesgoda, and welcome to AZH Wound Center in Milwaukee, Wisconsin. I'd like to share with you an exciting new technology that we're going to be incorporating into our practice. Now, this patient was treated for a traumatic hematoma. It was drained, and then following the drainage, we managed it with negative pressure wound therapy. You can see the wound here on her knee. She had a significant amount of tunneling in this direction. That has essentially resolved. And as you'll note, the wound base is very nicely granulated. We have been soaking her with hypochlorous acid for the past few minutes here to clean the wound, and we're removing a little bit of the fibrinous material with this gentle mechanical debridement. What you'll notice about the wound is that the negative pressure therapy has done its job. It has granulated the wound. It is essentially flush now. There is very little evidence of undermining, no tunneling, and no significant depth. This wound clearly has reached an endpoint for negative pressure wound therapy. We're going to transition to a product that I think is an excellent technology to use when transitioning off negative pressure wound therapy. The dressing is called Altrazeal. Altrazeal is referred to as a transforming powder dressing. And it has the ability, it is a polymer dressing, it has the ability to adhere to the wound base, maintain an excellent moisture layer at the wound surface. It also is able to, with its ability to move moisture across the polymer, it has a high vapor transfer rate, and so any excess moisture actually goes through the polymer dressing and is evaporated into the air. At the same time, the powder dressing, Altrazeal, maintains a very nice moisture base at the wound surface, which is what we want, moist wound healing. It provides a very nice protective cover to the outside environment, so it's a barrier dressing, preventing the entrance of bacteria to the wound surface. And many patients find that they can get away with minimal secondary dressings, sometimes only just a gauze dressing, just to protect it. I've had patients with no secondary dressing. After we put the Altrazeal on the wound base, they can leave it open to air, and that is very satisfactory. We open the Altrazeal packet. It has the powder inside, and what we're going to do is just sprinkle this powder on the wound surface. And I'm creating a little funnel opening, and we're just going to shake the container gently, and I'm going to get the Altrazeal to start coming down that funnel that I created. We want to cover the entire wound surface. If you get a little bit of the Altrazeal outside of the wound, that's totally acceptable. It will not adhere to dry skin. After we've covered the entire wound base with a very thin layer of the Altrazeal, you don't need a lot of this dressing. In fact, it's suggested that thickness should be about the thickness of a dime or a nickel. We don't need more than that. You'll see that the Altrazeal is now covering the wound base as a dry material. We now need to activate the dressing, the powder, with moisture, which then again begins the process of polymerization, allows that polymer to adhere to the wound surface, and turns it into an active dressing. Right now, it has not been fully activated. And we do that by moisturizing. You can moisturize the Altrazeal with either normal saline. I like to use hypochlorous acid to get a little additional antimicrobial effect, and I'll demonstrate how we do that right now. So I have a little container of Vash here. What I'm going to do is I'm going to take a gauze, get it moist, and then I'm going to moisturize the polymer, the Altrazeal, and I'm going to do that by gently dripping. As you can see, you have to be gentle here. I'm going to have you rotate your leg just a little bit. There you go. One little drop is all you need. It goes a long way. And you just track that down. You can see the polymerization occur. The Altrazeal is now becoming actively incorporated into a polymer form that adheres to the wound surface, and there's all you need. You see we've hydrated the entire dressing. It's completely covered, well hydrated. You can see the Altrazeal that's on the side of the wound, the peri-wound tissue easily just flex off. Here's an example of what we're actually finding on the wound surface. You'll see a little bit of the Altrazeal. It's very, very adherent together. It does form a polymer. The polymer provides a barrier to the external environment, creates a very nice moist wound environment at the wound surface, but yet again, because of the moisture and vapor transfer rate across that polymer, any excess moisture drainage from the wound surface will go through the polymer and be evaporated. So this is all we need to do right now, and in fact we're going to allow this to be sort of in a dry. It doesn't need to be remoisturized. After you've activated the dressing, you just leave it alone. We're going to go ahead and cover it with a little bit of a gauze just to protect it because of the area of the wound. As you can see, it's an area of high mechanical strain based on the fact that it's right over the surface of the knee. So when our patient ambulates, that tissue will flex a little bit, and so we just want to protect it. I'm going to allow her to shower with this. We'll see her back in a week, and we will update you at that point. So again, I hope you found this introduction to this exciting technology, Altrazeal, helpful and educational, and I would encourage you to take a look at this technology and see where it might be incorporated into your practice and the management of your patients. Thank you very much for joining us.